So I want to define that term insulin resistance because I think I've said it a few times. And really, what it is, insulin is a hormone released by your pancreas. It goes out into the bloodstream and signals the cells in your bodies to uptake nutrients. When there's a lot of exposure to insulin, in other words, in our overnourished individuals, there's a tendency for those cells to become less responsive. They're almost inundated with the signal so much that they start to ignore it a bit. And we call this insulin resistance. The result of that is if you're not responding to the signal, you're not uptaking the nutrients start to build up in the bloodstream. And that's one of the key factors that leads to type 2 diabetes. It's not the only one, but it's key. So what I'm highlighting on this is sort of the body composition changes leading to some of those metabolic changes that we saw in the labs, and then of course leading to disease. From here, we'll talk about how the disease sort of impacts the outcomes on your organs or end organ damage, all the things we're trying to avoid. It's not all doom and gloom. There's actually some good news. Muscle actually does a lot of the opposite. It's a huge reservoir for nutrients, and it's very insulin responsive. So in our diabetic patients and our patients that are insulin resistant, we're oftentimes trying to really have them build muscle because it's, again, a very greedy tissue. It takes up a lot of nutrients in a good way. It's only second to the brain in that. So the more muscle we can put on, generally we can reverse a lot of these metabolic problems.